formally start. Great, there we go. So welcome and thanks for joining us to hear about our programme in Population Health Sciences here at UCL. It's really great to talk to people about this degree programme, which in some respects still feels relatively new, but actually been going for quite some time now. We've been running this programme since 2015, so we have quite a few graduating cohorts of students who have gone on to do some really interesting things, which I'll talk a little bit about when I go through a couple of slides that I'm going to show you. But before I do that, let me just introduce myself and introduce the other people we have on the call today. So my name's Stephen Jivraj. I am the academic lead, program director, as I've written on the slide there, of the degree program in Population Health Sciences. So along with other people here at UCL, I'm sort of involved in sort of setting the curriculum for this degree program and sort of overseeing the day-to-day management of it. I'm joined by three colleagues who I'll let them introduce themselves. So we have Vasudha and Lizzie, who are current students on our course in Population Health, and Alison, who is a marketing officer. So Alison, would you want to introduce yourself first?
Oh, sorry, I was on mute. Hi, everyone. Thanks so much for joining us today. Yeah, my name's Alison, and I work in the Faculty of Population Health Sciences. So we have 8 institutes under the Faculty of Population Health Sciences, and the BSc sits within the Institute of Epidemiology and Healthcare. So I help the programmes run open days and sessions to help prospective students find out more about our programmes. Thanks so much.
Brilliant, thank you, Alison. Lizzie, do you want to go next?
Yes, hi everyone, nice to meet you here. And I am Lizzie, studying Population Health Science, and I'm currently in my year 2. I'm joining this session as an open day ambassador of the program.
Great, thanks, Lizzie. And Vasudha?
Hi everyone, nice to meet you. I'm Vasudha. I am a population health science student in my 2nd year, and I'm on the normal pathway. And I'm here as a course ambassador as well.
Great, thanks guys. And you guys that are joining us, would you mind switching on your audio and just telling us a little bit about what you're currently studying, maybe your A-levels? So we've got Jani, is it? Janani? I don't know, Alison. Can the delegates turn their audio on? Is that functionality there? Or Jemika? Maybe you guys are too shy. No, not to worry then. I'll like I said, what I'm going to do now. Okay, so one of you saying that your audio is not working, no problem. So what I'll do is I'm going to take you through a couple of slides. But as Alison said, this degree program in Population Health Sciences sits within something called the UCL Institute of Epidemiology and Healthcare. So it's quite a big department, and we call it an institute in that part of the university. So it's quite a big department within UCL. We have a very long-standing research history. We have lots of large research grants. We house a lot of large-scale social surveys, things like the Health Survey for England and something called the English Longitudinal Study of Aging. So really big data sets which are funded through sort of multi-government partnerships, which bring in millions of pounds each year to UCL for delivery of these data. So we're very much a very research intensive part of UCL, which UCL itself is a very research intensive university. You know, seen lots of the standings where UCL sort of lies in certain international comparisons. So by coming to UCL, and certainly by coming to do this degree in Population Health Sciences, is you'll be immersing yourself and doing a degree which is very research focused, you know, really at the forefront of academic science, and being taught by some really well respected and world leading researchers. But let's talk a little bit about what we mean by population health. So If I were to ask you guys, and I won't, because I know one of you said your audio's not working there, but if I was to ask you, how could we measure the health of a population to compare it with another population? And I think one of the most critical measures of population health is a measure of life expectancy. So how long we're expecting people to live. And it's probably one of the most widely used measures of population health with which to compare different populations. And what you can see on screen there is an infographic which was produced by the Department for Health quite a few years ago, using data from the Office for National Statistics on life expectancy estimates for small areas that surround tube stops along the Jubilee line here in central London. I've actually updated the data on the slide there, so it's a bit more recent than the original infographic. But what it shows there is that male life expectancy in the neighbourhood that surrounds the Westminster tube stop in central London is about 84, 85 years. Now, if you travel eastwards along the Jubilee line from Westminster out towards a place called Canning Town in East London, so a journey that will take you probably about 20 minutes on the tube. You could probably even do it on a bike or potentially even walking if necessary. It's not a huge geographical space between, but traveling across the tube stops along the Jubilee line, what you'll see on average is about a 1-year reduction in life expectancy for every tube stop you pass, until you get to Canning Town in East London, where male life expectancy for these data, which are probably about 4 or 5 years old now, stands at around 79, 80 years. So quite a big difference in what is quite a small geographical space. And so one of the key aspects of studying the degree here at UCL in Population Health Sciences is looking to see what determines people's health in different places to different levels. So why do people in Westminster have clearly a better health outcome here in relation to their life expectancy than people in Canning Town? And so what you'll explore on a degree in Population Health Sciences is the really important individual determinants of what makes people's health good and bad. So things about what they do for a living, how much they earn, who they live with, are they married, this sort of thing. We'll also look at wider determinants. So here, I think our minds are sort of immediately thinking, is there something about these places? Is there something about Westminster which causes better health than Canning Town? And that may be the case, and that's something else we look at in detail in the degree in population health. So how the environment impacts upon our health. And when I talk about the environment, I just don't mean necessarily things that you typically sort of think about in relation to the environment, like potentially pollution, but also the nature of the space. What are the type of people who live there? What are the services that are available that affect our health, education, social services, all things like that, as well as the natural things which may impact upon our health, like health services. Although often health services tend not to be a huge determinant of our health. In fact, in a country like the UK, where we have a national health service, often a lot of the distribution of resources that tends to be targeted towards the places that have worse health. And so sometimes some of the better health facilities are actually located in more deprived places. And so the cause of the poor health in those places is not necessarily to do with the provision of the healthcare service. And so turning back to our degree in population health, and let me just move my head a little bit there so you can see what's written on the slide. So the types of things that we want you to achieve on a degree in population and health sciences are the things that are listed there. And I won't read them out to you, but I'll let you have a read through them. And hopefully the thing that strikes you about those things, which we call learning outcomes or learning objectives, so things that we're expecting you to achieve by the time you come to graduate, and you'll see that very few of them are sort of specific to the area of population health sciences. In fact, they're much broader than that. They're general skills that you're probably already learning on whatever it is you're doing at the moment, A-levels. Or if you were not to do a degree in population health sciences, but you were to choose another degree program, there are things that you would, the type of skills that you would learn on those. And that's intentional. You know, we want to teach you, we want to immerse you in the research, the really really important and really novel research that we're conducting here at UCL. But we also, through the process of understanding population health sciences, we want you to gain some really important transferable skills, which I think will prepare you well for whatever it is you choose to do next, whether it be postgraduate study or going on to work. So just to take but a few of the things there. So really important, being able to analyze data, to take data of any sort. It could be, we often think of data as quantitative, lots of zeros and ones. We could also think of data in other sort of forms. It could be just text, it could be reports, or it could be qualitative data, interviews, things like that. But taking that data and being able to use it to make an argument, and particularly in written format, to write things like essays and reports, but also to present data orally as well. So on our course, there are a lot of the assessment is essay-based, but there's also lots of assessment which is based upon doing things like oral presentations, and also other sort of novel types of assessments where you don't write a standard essay. Now, one thing that I'm often asked about our degree program in population health sciences is where can a degree like population health sciences take me? What would I do? What would I do? What job would it lead to? And I can say with some certainty around what our graduating students have gone on to do. And I can also say what some of our students have done whilst they've been at UCL by doing things like internships. And we have had internship agreements with organisations like the NHS, public PHE there stands for Public Health England, who actually don't exist anymore. They've changed their name and have been absorbed into the UK Health Security Agency, as well as other organisations within government. But we've had interns that have gone to those organisations too. We've also had students who have done internships outside of the public sector in private sector consultancy. So I've listed an organisation there called Health Lumen, who's a private sector health consultancy organisation who conduct a lot of research on behalf of organisations like pharmaceutical companies. And also some of the organisations listed on the slide here are places where people have gone on to work. So we have one student who works for the organisation IQVIA, which is a very large organisation that does healthcare research across a spectrum of different areas. We also have graduating students who have gone on to work in local authorities. So local authority that UCL is located within, Camden, they have very important health functions, particularly around preventing poor health. And so we've had quite a few, 3 or 4 graduating students who have gone on to work in local authorities in those sorts of roles. And so I think by doing a degree in population health sciences, there is the potential to further or move on to a career in what we call the sort of health economy, the health sector. But I don't think you need to think of a degree in population health sciences potentially leading you down that path. Because of what I was talking about previously about those generic skills that we expect our students to be able to demonstrate by the time they come to graduate, a degree in population health sciences is perhaps not that dissimilar to many other degrees in the social science in the UK higher education sector, in that the skills that you learn will enable you to go on and move on to graduate jobs in sectors of the economy which disproportionately employ graduates. So, for example, I'm thinking here of financial services, which is the largest single sector of the economy for graduate jobs. And we've had quite a few students who've gone on to work in organisations like PricewaterhouseCoopers and other organisations like that as well. So I would not sort of want you to think that if you're coming to do a degree in population health sciences, is that you're specialising yourself as a person and narrowing potentially career options, or also potentially postgraduate options as well. I think, if you come to do a degree in population health sciences and you find that the element of population health is not for you, I think largely the world is still your oyster in terms of what you could do in terms of postgraduate study. Potentially even the option to continue into graduate medicine is open at some UK higher education institutions. Unfortunately, not UCL. You can't do graduate medicine at UCL, but we have had students who have completed our degree in population health sciences and have gone on to do a graduate medicine course in other universities in the UK and overseas. That is really all I wanted to say. There's some information on the screen now, which perhaps you might already be familiar with in terms of our email address. Want to find anything else about the course, by all means, please drop us an email, and the staff that are involved in managing our degree in population health sciences would be more than happy to answer any question you might have about the course, or most of the information I think that's sort of typically needed to make your application through UCAS is available on the UCL website. So things like entry requirements and such like, and program structure. But I'm going to pause there, and before we move on to our next section, which is to reintroduce our current students and get you guys that are on the call, hopefully, maybe via the chat, to ask our current students some questions. What I'll do first is I'll just pause for a moment and see whether you would like to ask me any questions about what I've just said, or anything about our degree program in population health sciences. So if you did want to ask a question, just pop it on the chat there, and we'll try and answer it. Okay, so Janani says, can I do this degree in can I do this degree in my BSc integrated year if I do medicine? Oh, no, you can't do this degree. That's a really interesting question about integrated BScs. We call them here at UCL intercalated BScs. So if you're not already aware, medical students, I don't know if it's the case in all UK higher education institutions, but it's certainly the case in UCL, in their third year, they get to specialise in an area of medicine or allied medicine, where they do a degree program essentially in 1 year. And population health, unfortunately, isn't one of those integrated degrees that you can do. But there are lots of ones that are similar, like global health. So there are sort of similar sorts of degree programs that you can do at UCL if you were to do medicine. Jemia has asked, what would you think would be the best thing to put in my personal statement for this course? Well, let me say a couple of things about that. Firstly, we appreciate that if you're applying to our degree in population health sciences, it may be the only degree of this sort that you're applying to, because there aren't many of these degrees across other UK higher education organisations. So it could be the case that you might be applying for medicine, for example, and this might be your 5th choice. Or you might be applying to do economics or geography, and then this is one additional choice that you're planning on doing. And we appreciate that you write your personal statement on UCAS sort of very generically for all the degree programs that you're applying to. So there wouldn't be an expectation when applying to this course that you tailor your personal statement towards this degree program, particularly if you're applying to those others. But to answer your question more directly, as someone who's read many personal statements, I mean, what I sort of look for is not necessarily sort of subject specific information, but what I want to see is someone who wants to make the most of their time at university. And I think you can demonstrate that in many ways. You can demonstrate that by telling us how you're interested in the subject that you're planning to study. Like I said, that can be difficult if you're applying to population health and different subjects. But also, I think what admissions tutors sort of like to see is people who are perhaps doing different things which are unrelated or maybe related to their area of study, but things like voluntary work or just interests that they have that they can demonstrate and that they want to further whilst they're at university. Because by coming to a very large university like UCL, there are so many things that you can get involved in. So there's, you know, the classic sort of student societies, but there's also lots of volunteering opportunities that are made available to our students through partnerships that we have with local community groups. And so, you know, someone who says that, you know, I want to go to university, I've done this thing in the past, and I want to further that. That sort of says to me that this is someone who's really going to make the most of their 3 years of their undergraduate degree program. So that would be my advice: is to state things that you can demonstrate you already have an interest in, and things that you think whilst at university you might be able to further. Okay, if you want to ask me any questions, please continue to put them in the chat. But perhaps while you're thinking of those, what I'm going to do now is I'm going to invite Lizzie and Vasuda to respond to some of your questions. And so, those of you that are on the call, I'd take this as a really great opportunity to grill 2 existing UCL students on anything you like. You could ask them questions about our degree program in population health sciences. You might want to ask them questions about what it's like to be a UCL student, or maybe you might just want to ask them questions about what it's like to be a student generally, because you guys are about to make quite a big commitment in terms of financially, in terms of how much it's going to cost to do a degree, but also it's quite a lot of time. You're going to spend 3 years doing this, so you're going to want to make sure you have the full information before you make any decisions about where you decide to go. So please drop your questions in the chat for Lizzie and Vasuda. And whilst you're thinking of that, those questions, perhaps what we'll do is we'll pose some questions to Lizzie and Vasuda. And so Lizzie and Vasuda, if I could just kick off, why did you guys choose UCL as a place that you wanted to study? So I can see, Lizzie, you've put your camera on first, you're eager to go. So Lizzie, why don't you take that one first?
So for choosing UCL, basically when I was applying, I really Googled every major that I was interested in, like online. And then it was like, first of all, it's really a good major in UCL. And I will say that I am still very confident that I choose the right major. And also like for UCL, it basically, firstly, its ranking is really high. And also for high ranked university, you really got good resources. It's from the school, it's from the society, like we got really good lecturers. And then also like from career wise, we always got lots of events for us to get to know what we need to prepare for our ideal industry, and then like all those research opportunities, and then some CV session, and then cover letter session. It really helped me a lot to get prepared for interviews and then for job hunting. Like compared to students from other university, I would say I really can, like UCL really helped me to balance my preparation for my future, as well as focusing on my study, my current career, my study time. Like I can do both things very balancedly.
Great, thanks. Maybe let's pick up some of those sort of student societies that I think you talked about you might be involved in a bit, but maybe Vasuda, do you want to come in on that question? Why UCL? What attracted you to UCL as a place to study?
So I wanted to study in central London anyway. And my main 2 unis were UCL or King's. And then I picked UCL because like it offered a lot more in comparison, like better societies, like as Lizzie said, like there's a lot more on offer for careers, like sessions, advice and everything. And in terms of the actual degree, I preferred this degree over Kings's. And then I just followed whichever one I genuinely wanted to be at. And after visiting both campuses as well, I preferred this one.
Great, thanks, Vasuda. I mean, I think that's a really interesting thing about sort of wanting to study in London. I mean, I think, if you're not already from London, I think actually coming to study in London is a really great experience, because it's expensive. And I think Alison wants to sort of address some questions on that as well. But coming as a student to study in London, because your rents, I mean, are still incredibly high, but are subsidized. So it's a great opportunity, actually, if you want to come and live in London for 3 years, do it whilst you're studying, because it's much cheaper than doing it on the private market you know, after study or having not studied and just wanted to come and live in London. But should we pick up that theme? Alison, did you want to pick up something on the cost of living, since I've already raised it?
Yes, I think we had one question in the chat about hours, how many hours a week you're in lectures, and how long lectures are, and then maybe we can come back to the cost of living. Does that sound good?
Yeah, brilliant. Okay, well, I'll hand that over to Lizzie and Vasuda. So Lizzie, first, do you want to tell us how many hours a week are you in lectures?
Well, like for first year, like I had those like online sessions, and I think basically online is like, especially for first year, it's more likely like 1 hour for each module, and then in year 2 it will extend like to maximum 3 hours for one module. So I think it really based on what course you take and then which year you're in. I would say like for me this year, like this term, like I got 5 modules, and so basically it's more like maybe 20 10 to 20 hours in total per week. And yeah, and then the length of the lectures really depends on which course you're taking, and it can be different settings.
And Vasuda, I mean, I won't ask you the same question because you're doing largely the same courses as Lizzie, but how do you find managing the sort of time? Is it, do you find there's sort of enough time for personal study?
I do find there's enough time because the way my timetable's set, so same thing as Lizzie, each module gets about 3 hours a week, and I'm doing 4 modules this term. So that's 12 hours of, you know, of being on campus. And then my timetable, I only have to be on campus for 3 days a week. So it works out really well in terms of I can do a lot more, yeah.
And do you typically spend your non-lecture days on campus, or are they at home?
They are on campus. There's attempts to do work, but like they are on campus, yeah.
I promise this is not a test of me trying to figure out whether how much you're committing. I mean, you can work at home. I'm at home now. We've got another question on the chat there, Alison, from Doinia, which is about pharmacy degree program, which we can't really answer, I think, because I don't know anything about that program, and I suspect neither Lizzie or Vasuda does. But if anyone does there anyone know anything about?
Well, for pharmacy, I don't know anything from doing master degree, but just for bachelor degree, I would say they really had very intense schedules, like because it's really one of the top major in UCL, and so if you choose that major, just make sure you're prepared to work really hard. That's all I can tell you.
Yeah, I would say that information will probably be on the prospectus page for that degree. So yeah, do check it out.
Can you see that?
Yeah.
Okay.
I'm not sure if this degree, Stephen,
can you see that okay?
modules, if there's any options in terms of, I don't know, optional modules that might be relevant to people interested in pharmacy. I'm not sure.
Is that any better?
Probably not within the School of Pharmacy, but that's a really good question, Alison, actually. So there are optional modules, and perhaps we can sort of cover that with what maybe options Lizzie and Vasuda have taken. But just in terms of the general structure of the degree program, the first year is largely compulsory. There are sort of a little bit of plans to change that at the moment, but that's a bit of a watch this space thing. But in the second and third year, there are progressively more options that you can take. So options within the department and options outside the department. And those options outside the department can be as diverse as UCL has options available for students to switch between different departments to do modules. I suspect the pharmacy the School of Pharmacy wouldn't fall into that category, because as I think what Lizzie's alluded to, the nature of that degree is around a professional qualification, and you probably wouldn't be able to do their modules unless you were enrolled on their program. And I think also to speak to what Lizzie was saying as well is I think it's definitely worth looking, because there are different courses do tend to have different sort of face-to-face contact time than others. So that's something well worth looking into if you're thinking of doing different degree programs. Shall we return to cost of living? Shall we talk about that? And did you want to question Lizzie and Vasuda, Alison?
Yes, I was just wondering how you both, sort of manage living in London. It's obviously sort of renowned for being an expensive place to study. Do you have any tips? How do you find it?
Well, it's definitely expensive. I think that's what helps me a lot is we get an increased student finance for staying in London. But on top of that, I'd say like it's not hard to manage your money, like living in London. You can shop, like you can do your groceries in cheaper places. You can go to Aldi, Lidl. And then on top of that, going out is probably going to be your biggest expense. But if you control that and if you do it sensibly, then you will be fine. And on top of that, with this year now, because you know we're all on campus, you're on campus a lot longer, so you'll be spending a lot less. You'll be like less likely to go out and stuff, which helps in the long run as well.
Yeah, so for me, basically starting this year, it's really getting really hard, I think, due to the economics situation. But I think it's really not hard like to maintain it as just within, you know, around 500 to 600, I would say, generally. And then one way to save money is really just cook yourself. And I think it is important that you do go out and have fun once or twice per month, but also that should be like just set up a range, like how much budget you want to spend like per month, and then make sure it's within this budget, and then just do the one like once and twice, and then you will be very used to this mode. And also like I have a book, like there's Lidl, Sainsbury, Tesco, Waitrose, and like there are some products you can find in all of those stores, and then maybe have a book and then just like write notes of how much you got this product in one store, and then just compare all those prices and then just choose the cheapest one to go for every next time. I think that like accumulatively you can like save a lot actually, and also like use some online shopping like top cashback, and also like for Christmas, Black Friday, there's always like huge discount. Like just seize the chance whenever you can save money. I think it's really not hard to like just live a kind of like quite high quality life, just also like not spending too much or like beyond imagination, like those kind of amount of money. Like it's achievable, even though like it's in central London, everything's expensive, but you can still use not so much money but live a good quality of life.
Yeah, they're really great tips, I think. Thanks, guys. And I really like the one, Lizzie, about cooking. I mean, that's something I wished I'd done as a student, is sort of cook to myself, like scratch cook. I mean, it's crazy, because I remember as a student, particularly at weekends, I had loads of time. Always, you know, lots of my friends sort of would go home, and I remember in our house we had loads of time to do these things, and it never did. And then as a parent now, trying to sort of teach my children, now I do a lot of sort of scratch cooking and enjoy it, but don't have as much time. But yeah, so I think that's a great tip. Alison, was there anything else that you wanted to pick up potentially about cost of living, or anything else that you wanted to?
Maybe on societies, because I there UCL is fantastic for the amount of societies there are, and just sort of work-life balance for you both, and how you enjoy your time outside of your program.
Are you guys members of any societies, Lizzie and Vasuda? So Lizzie first. I think Lizzie's only. Are you?
Yeah, just for work-life balance, I would say, well, firstly is like, for me, I would like keep track of my daily emotion, and then like whenever I feel like there's a downtime, it's always very easy to get a train ticket and go out for a hiking or something, just 1 day trip. And I think that helps a lot to get the balance back. And also like always like plan things ahead. The deadline will be posted, I think mostly like just at the beginning of the term. And then the topic will be given like 1 month ahead. And then so you got like the whole month to work on the essay, work on the assessment, and just plan like, don't leave it to last minute, and just plan like use whatever time you have, and then just make sure you do all those things ahead. I think that's very important. And then so then when you got so overwhelmed, you can still got chance and time to do something else and get your brain cool down instead of get it fried. And yeah, I think that is very important. And I really learned, like I spent the whole first year to learn that, to adapt to university pace, and just don't give yourself too much pressure, especially in the first year, and then just do whatever you can to learn what this degree is trying to looking for, like from you, and then what you want to get from this degree. I mean, that is really important. And I think that is a very necessary thing you need to do, because I think it's more like a direction for the rest of years you are in UCL, and even in when you are doing your master in Central London or other universities. That is very important. And yeah, like it keep your mind clear, I would say.
And Vasudha, how about you? Are you part of any student societies?
I'm sure. Oh, sorry. Me, maybe.
Oh wait, I just go to Vasudha. Maybe
Oh, sorry. Sorry. I'll just give it the mic to her.
no problem.
I'm part of UCL's Indian Society and our Hindu Society as well as our Punjabi Society.
And do they have events that they run?
Yeah, there's a lot of events. There's always something going on. Like our Hindu Society will do like Diwali balls, like all the religious events, and then Indian soccer is more like Desi nights, just something for everyone, like food socials, like there's a lot going on.
And if don't mind me asking, how involved are you with those societies? Are you on committees?
I'm the president for UCL's Indian Society. That's why I'm telling you, like, we do so much.
And
Yeah.
is that something you'd encourage other students to do, is to sort of get involved in the committees and societies? What do you get out of it?
You get so much out of it in terms of, so when I was in first year, I went to all the events run by Indian Soc, and that's how I made literally all of my friends. And genuinely, like, join your cultural society, join your religious societies, join any things you're interested in. Like, we have some really cool societies here, like Harry Potter Society, you know, it's endless, the list. And in terms of committee, it's definitely really good because you're working in a team. You can apply for whatever role you want. And if you get it, then like you're part of, UCL has really, really big societies, and you're part of a really, really good experience as well. And organizing events and stuff, like, it's stressful, but the outcome is always so good because everyone has such a good time. So
Great.
Yeah.
Thanks for that advice, Vasudha. And Lizzie, are you part of any societies? I interrupted you before.
Yeah, I'm currently like in the scuba diving club, and basically I'm the trip secretary for that, and I do all those events and trip organizations like for the club members. It is really hard, like for managing stuff for a big group of people, but just like Vasudha said, it's really rewarding every time. Just done every event and also get really good feedbacks from the members, and also like seeing they enjoying what we have organized, seeing they enjoy the moments. It's really worth it. And I would like suggest like a new student, like the freshers, to join as many as possible that they feel interested in. And there are like test weeks, I think. And you can like go to hiking club and other sort of like sports, or like I think there's movie clubs as well, like different types run by students, run by the schools, I think. And also there's like volunteer opportunities, like just tryouts, and then I think you will find something you really find really interested, and then also make good friends. And then I think it's also a good way to get your mind and yourself recharged every week. It's important to get some, like, do something else other than study and get the most from this school.
And can you try before you buy, before you like subscribe to societies? Can you?
Yes, like there are like test sessions. Like I think they're like 2 to 3 weeks maybe. That they organize those events, and then send emails, I think, and then, or like some do group chat. And you can get all those informations and can choose you wanted to join this event or not, and try multiple times and decide if you want to be like official member, which means you will need to pay for the membership. Yeah, like you always got a chance to decide before you actually to like try before you make the final decision. And I think the price is not that high. It's usually £5 for the clubs, and then I think for scuba diving it's more expensive because the club gives discounts to the members, so it will be a little bit high. Yeah.
Great.
Stephen, just to
Oh,
say, we've got a question in the chat.
Yes. I was going to come to that next. Thank you for pointing me to it, Alison. Brilliant. But thanks for those experiences, guys, about the society. So there's a couple of questions which we've not addressed in the chat. The first one is about another degree program, about the law program. And again, sort of same applies there to the pharmacy one. I don't think sort of any of us are probably have any experience there to sort of draw on. So again, I think you're probably best looking at the UCL prospectus for that specific degree program to find out about it. But there's another question there about, would you recommend living on campus if London is a 40-minute journey? Vasudha, did you want to pick that one up first? What would your view be on that?
I think yes. I wouldn't, the distance, my house is 20 minutes from London, but I still live here because the experience you get from just living alone, even if you do it for a year, I think it's so worth it. Like I get home is very close and it sounds more convenient to just go back, but the life skills and everything you gain from living alone for a whole year, like it's unbeatable. So I definitely recommend living on campus.
And would you have a view on that, Lizzie? If that were an option for you, would you?
Well, so first of all, as international student, I think yeah, I will have to find a flatmate or choose studio. But I would say, like, because I've been living abroad like about like almost 10 years, and I would say in those years I really learned a lot by just living on my own. And also I now start cooking, which I would never do when my parents are around me. And also, like, you will need to manage your time instead of like having your parents tell you like when to get out, when to have dinner, when to do something. Like the most thing I've learned out of like living on my own is really the time management skills. And I think it's really important when you are like not just like just daily living, it's also like for studying and then for working. You need to have those self-motivation and the ability to set up a schedule for yourself instead of having others to tell you what to do. And also, I mean, like, I lived in Wembley, which is about, I would say like about like 40 minutes journey like daily from my home to school. And sometimes there was like strike, like transportation can be really hard and it can be really heavy traffic jam. So personally, I would suggest to live on campus. It's not just about like, you know, closer to school, closer to friends, and also like I think you can always use the library resources, and then like there are I think multiple, like you can choose whichever is your favorite and then just go to the library. I think it's really it's effective to me. Like I can't do things at home, but as soon as I arrive at library, I can just really focus like for hours and just get one thing done, and then the next thing like for hours I can just sit there. It works for different people, just my personal will. So as a reference, you may make a decision for that. But even if you don't want to live on campus, you want to rent a house by yourself with your friends, I would suggest to be within zone 2 is the farthest like you may want to think of it. And then also like make sure you check the Google map and city map before you rent the flat, because some may like take hours, even though it's like within zone 1. You may need to transfer like multiple lines to get to the school, and that can take up to 1 hour. And also you may want to think of the delay of the tube, and then also sometimes a strike. Just make sure you always get a plan B, for example, bus to get to school if you need. Yeah, I think that's what you need to think of when you are like trying to find accommodation.
I'll just quickly say as well, I studied in central London, and I initially lived on campus for 2 years, and then in my final year I commuted in, so that's also an option you can think about.
Yeah, that's a great idea. Alison, actually, to mix it up, if you've got that option, if you've got parents who sort of live within commutable distance, you could sort of mix it, couldn't you, across the years? And I think Lizzie's suggestion there of a plan B when you are sort of planning out where you are going to live is a good idea in terms of how you're going to get to campus. Guys, we've only got probably about another 5-10 minutes. So if you guys do have any questions for Lizzie or for Vasudha or for me, then please think them up and drop them in on the chat as quick as possible, and we'll try and get them answered before we finish. But whilst we're in a bit of a pause on the questions, I would like us to return to the degree programme. And we talked earlier about optional units. And before we ask Vasudha and Lizzie about the options that they're studying this year, something I wanted to say about the degree programme is that there are 2 options of routes that you decide when you enter in onto the programme. So we have what's called our main programme, which is doing all of our courses in our department in epidemiology and healthcare, which are largely focused around the area of social epidemiology. And then there is a separate route called data science, which allows you to specialize in some really advanced data science, quantitative data analysis, statistics, call it what you will, options. And I think, Lizzie, you're on the data science route, aren't you? And
Yes.
you're on the main program. But do you both want to just introduce, maybe just talk a little bit about why you chose your route, and then maybe also tell us a little bit about the options that you've decided to study this year, which are maybe not tied to your route, but just options that you've wanted to study. So Vasudha, do you want to take that one first?
Yeah, so I'm on the normal pathway for second year. I did the data science one for first year, but I felt like it wasn't for me, so I moved on to the normal pathway. I prefer the modules for that. In terms of optional modules, for term 2, I'll be doing, well, human rights and world politics as one of mine, and then immunology as well. And I wanted to kind of cater them to what I want to go into after my degree. That's why I picked them as my optional, because you can pick from literally any department. You have so many options when it comes to optional modules. So.
Great, thanks Vasudha for that insight. And Lizzie, do you want to tell us a little bit about the route and maybe the options you're studying this year?
Yes, so I'm in data science pathway, and the reason why I choose it because I really met a good math teacher and who made me think like math is something I want to keep doing with, and yeah, and also like data science is really useful. Like for this like for data science, like what we get from this, you asked?
Well, I think someone's actually asking about that on the chat actually, but maybe you address what the options that you've taken this year.
Yeah, so this year I've chosen as option module, like I chose anatomy, and the other one like from our own department. Yeah, so there's a question like if you can take modules from other departments, languages, yes, and but like for data science, you only got 2 option modules that you can choose, and I think only one is able to be selected from the other departments. So if you want to choose languages, that may be something you may need to plan ahead, like, and also there's like nice school for languages, and I think that's also very a very good option. And also like for data science, what I would say that I've learned a lot from this is like we focus on R, and R comparably is easier than Python and Java, I would say. But also like it's really powerful tool when you are like drawing, like trying to get a draw. Like we are currently like learning maps, and I think that is something you would at first thinking it's very close to the geographic students, but it turns out like it can be related to our major to use in medical area. Like for example, you wanted to see if there's a cluster, if there's like a trend where such diseases have happened in this area, and trying to figure out why. I mean, that is something as for data science, you may have never thought you can do, but after learning, like taking these courses, that is something that you can think of, and there are more to explore. So yeah, for...
Do you have a background, Lizzie, in maths or statistics prior to coming to university? Did you do those subjects?
I took Python and Dr. Racket like in my former university. So I got some background, but I don't think that really is a thing for me to take up data science in UCL, because I still think it's really different focus. Like for us, we need to like write the report. It's not just about coding. It's also like how you understand your coding, how you understand the result, how you analyze the result. It is not just about you get this problem solved, you write this coding, you get it run, like there's no bugs. It is more than that. You always need to understand what this tool is telling you. It's more about like using it and then like make a service for you instead of, you know, just simply answer questions.
Great. And there's a couple of other questions that I'll try and address on the chat there. One is about the skills that you gain from this degree. So Ritika, you might have missed the bit I was talking about earlier about generic skills, but a degree like this in population health sciences, the skills are very transferable, very, very generic. Obviously, you learn a lot about population health sciences, but there are a lot of generic transferable skills that Lizzie was alluding to there about sort of writing reports and being able to analyze data and working in groups to do reports as well as presentations and that sort of thing. So there's a lot of transferable skills that you would learn on this course if you were to come to study it. And we've also been asked a question about what to include on personal statements in relation to things like activities or work experience. And for this course, I would say there's nothing specific. There's no particular thing I would do. You know, I think we need to be sensitive to the fact that many people have the option to do those. You know, if your parents are sort of wealthy enough to enable you to do those things, then great, and that's fantastic. But not everyone has that luxury. You know, some of you I know will probably be having to work through your summer holidays just to sort of maintain your sort of family existence and prepare probably to move on to higher education. So I don't think there's anything particular that you need to do, but I think, as I talked about earlier, it's just a demonstration, I think, about how you want to make the most out of your 3 years at university in relation to the substance of whatever it is you're planning to study, but also all those things around those societies, which Lizzie and Vasudha have talked to us about, you know, talking about those things and how going to university is going to enable you to further that interest and develop as a person. And that to me would make me think, okay, we really want to give this person a place on our course because they're demonstrating to us already that they're going to make the most out of this opportunity. We have 1 minute left, so I don't propose you send any more questions, although by all means do, and maybe we can answer them via another forum, but we probably won't answer them now. But before we finish, is there anything else, Lizzie or Vasudha, that you guys would like to say to the people we have on the call? Lizzie, is there anything, you don't have to, but is there anything you'd like to say?
I just say this course, I love this course, and studying at UCL is a lot of fun, and also being in central London. Like you'll always have something to do. And this course, like, everyone's always very helpful. You can contact anyone, and there's also a lot of advice for your careers as well. So I definitely recommend it to everyone.
Great. Lizzie, is there anything briefly you would like to end on?
Yeah, like for many people, like they raise questions about like law, pharmacy, and medicine. I would say I was a part of that group as well before I choose this major. Like I know these are like really good career type, like for law, for being a doctor or something. But I would say after I really studied population health science, I would say I had never regret, and there are like I'm getting more and more confident that I really want to do this, like focus on population health science for my future, like as my future career. Like it really gives me a really bigger picture for what is going on worldwide. It's not just about epidemiologists. It's just not about like, all those like researchers. It's more about like what is going on in the world, what has causing it, and as a lifelong term. And then also like, there are like so much like about aging, about cancer. Like you get to learn so much more than just, what is this disease? What medicine should I use to cure this disease? It's more than that. And I think you can do more by learning population health science to like the world, instead of just focusing on what you have in front of you. And also like even if you want to do medicine school, or like you are not so sure for now, I would say choose population health science as for your bachelor degree, and then use this time not only just to build up your background knowledge for multiple disease methodology, and also like some research method, quantitative research method, and also like get this time to think what you want to do, because like medical area is really broad. Yeah,
Brilliant. Great. Thank you, Lizzie. And I'll just defer to the boss. Alison, is there anything else that I need to say or do before we close today?
No, not at all. It's been brilliant. Thank you so much to you all. And Aisha joined the meeting a bit late, so I'm happy to stay and speak to Aisha a bit more and answer any questions Aisha might have as well. So if that's all right with everyone.
Yeah, brilliant. Well, thank you very much, Alison, for putting together the event today. That's been brilliant, and thank you so much to Lizzie and Vasudha for your time and telling us all about your experiences, which is great. And I'm sure the students on the call have really appreciated that. And I think it's always best to hear it from the mouth of the people who are actually experiencing it, because we put the program together and we don't experience it, we just deliver it. So it's coming from a very different perspective. And the last thing I would like to say is that our interaction doesn't have to end today. If you guys have got any questions that you want to follow up on, then by all means contact us on our email address, which is the BSc Population Health Sciences at ucl.ac.uk that I showed earlier. I'm sure you can find us if you search the UCL website. And so by all means, get in contact with us. And if you want to ask any questions or potentially even come for a visit, then I'm sure we can facilitate that if you're interested. So just a final bye from me, and thanks for coming today. Bye, guys.
Thanks so much, everyone.
Thank you very much.
Bye.
Thank you. Bye-bye.
Bye-bye.